Welcome everyone, and thank you all for being here today. My name is Delphine Asley, and I'm a proud granddaughter, a donor, and the Executive Director of the Perley and Rideau Veterans Health Center Foundation. Before we begin, I would like to take a moment to acknowledge that we are on the traditional and ceded territory of the Algonquin and Anishinaabe people. Wow, today is an exciting day and an important milestone for seniors care in Canada, as we mark the formal launch of the Perley Rideau Center of Excellence in Frailty Informed Care. No other organization in Canada currently focuses on developing and implementing innovation in care, education, and actionable research specific to frailty in long-term care. Our Center of Excellence collaborates with researchers, older adults, caregivers, healthcare providers, government, industry, to conduct applied research and deliver innovative care solutions and education to improve the quality of care of older adults living with frailty. And now, I would like to turn it over to retired Navy Captain Paul Gando and current Chief Operating Officer of Commissioner of Ottawa for a very exciting announcement. Paul?
Thank you, Delphine, and welcome everyone. It's an honor to be here today. My name is Paul Gando. I'm the Chief Executive Officer of Commissioner Ottawa. As a not-for-profit company with a veterans-focused social mandate, Commissioners Ottawa is also committed to ensuring the best possible care for those who have served our country after they retired and as they grow older. We know that the Perley Rideau provides excellent care to veterans and seniors in Canada. In fact, the Perley Rideau has been our loyal partner for over 2 decades. Our most recent donation of $1 million went towards the Perley Rideau Senior Village, where one of the assisted living buildings is named Commissioners Ottawa Place. Today, we know that the Perley Rideau new Center of Excellence in Frailty Informed Care will help transform senior health in Canada. We know it will pave the way for innovative care solutions for veterans and seniors with frailty. I would like to acknowledge the members of our board of directors here today who are distinguished veterans and volunteers. One of the reasons that compelled us to donate to this research was learning something new about frailty. Many of us understand that frailty affects quality of life and risk of death. But what we at Commissioner Ottawa learned is that frailty is not something we should expect as we age. We learned that frailty is actually a medical condition. And medical condition can be researched to provide better care and treatments. This was great news for us. We want to do our part to show veterans and seniors that we value their contribution at every stage of their lives. And we want to show them we are invested in medical research to help them live life to the fullest. This is why, on behalf of Commissioners Ottawa Council of Governors and our Board of Directors, I am pleased to announce our donation gift of $2 million to the Perley Rideau new Center of Excellence in Frailty Informed Care. This investment will directly support important work in applied research, knowledge transfer, and the creation of evidence-based best practices. This research will positively impact the lives of older Canadians at the Perley Rideau and across the country. It is an honor to support the Perley Rideau, which is a pioneer in frailty-informed research in Canada. We hope others join us in donating to this cause to have this $2 million gift. And now, I will turn it over to retired Commodore Dr. Anne Young to give remarks on behalf of the Perley Rideau. Merci et bonne journée.
Well, thank you, Captain Guidon. I also look forward to our ongoing collaboration into the future. Caring for seniors, including our veterans, has been the heart of our organization for more than 75 years. And I'm honored to be here today to mark the formal launch of the Perley Rideau Center of Excellence in Frailty-Informed Care. I joined the board of the Perley Rideau in 2014 because it was a natural transition for me into civilian life. I served 31 years and more in the Canadian Armed Forces as the most senior doctor and Surgeon General and Commander of the Canadian Forces Health Services since 2012. I spent my entire professional career as a physician in the Canadian Armed Forces. So when I retired, I decided to start a civilian medical practice dedicated to the care of veterans only. This was because I realized on retirement and before that many veterans had difficulty finding a doctor, number one, in the first place, and often a doctor with some experience and knowledge of military service. So when I was asked to join the board in 2014, it was, as I said, a natural transition. The concept of a COE was planned from several years ago, as Perley Rideau came to realize that dedicated, evidence-based best practice relevant to residency and long-term care was lacking in focus. The pandemic only further highlighted this deficiency and the need to improve care for residents in long-term care. However, real research and progress cannot be made by wishful thinking alone. So this incredible work is only made possible because of generous donation, such as the one announced today. This $2 million donation from Commissionaires Ottawa, the largest philanthropic gift in our organization's history, will empower our Center of Excellence to continue its critical work to improve the quality of life for veterans and seniors living with frailty in our community and across Canada. In recognition of this gift, I am pleased to share that the Center of Excellence Research Chair title will now be known as the Commissionaires Ottawa Research Chair in Frailty-Informed Care. This position, this first research position, is held by Dr. Annie Robitaille, an assistant professor in the Interdisciplinary School of Health Sciences at the University of Ottawa. She has dedicated her career to researching a broad spectrum of issues related to aging. You will have an opportunity to meet Dr. Ratash shortly as part of the panel discussion. On behalf of the Board of Directors of Perley Rideau, thank you, Captain Guidon, for your tireless commitment to improving the lives of people in our community. I will now pass on to John Jarvis, co-chair of our Answering the Call fundraising campaign, to say a few words. John, over to you.
Thank you, Dr. Young, and thank you, Commissionaires Ottawa and Paul Guindon, for your ongoing support and your partnership. This generous $2 million gift is part of the Answering the Call fundraising campaign, which aims to transform care for millions of seniors across Canada, while continuing to sustain exceptional care for hundreds of veterans and seniors living at the Perley Rideau. Through these philanthropic investments, our $10 million goal will fund applied research projects and propel the growth of the Center of Excellence. I would now like to share a brief video greeting from former CBC news anchor and our honorary campaign chair, Peter Mansbridge.
Hi there, I'm Peter Mansbridge. We've learned a lot about ourselves in this past year, haven't we? About who we are, about how we treat others, and especially about how we treat our seniors. As the pandemic has shown, seniors have special needs and vulnerabilities. Caring and supporting them is an urgent issue, and it cannot be ignored. That's why I'm proud to lend my support to Answering the Call, a campaign to help millions of seniors and veterans across the country. The campaign is led by the Perley and Rideau Veterans Health Center, the largest of its kind in the nation's capital, one that has earned the trust of Veterans Affairs Canada. So why don't you join with me in making a better life for seniors and veterans? You can find out a lot more at answeringthecall.care. That's answeringthecall.care. Hi there, I'm Peter Mansbridge.
On behalf of all of our volunteers and staff, I want to thank Peter and Commissionaires Ottawa for placing their faith in us. And we hope your generosity will inspire others in our community to answer the call and improve quality of life for veterans and seniors, which the pandemic has shown is urgently needed. We will now turn it over to our special guest and moderator for today's expert panel discussion. Andre Picard is an award-winning health columnist for the Globe and Mail and author of Neglected No More. He is a distinguished recipient of the Michener Award for his public service journalism. He is deeply passionate about caring for others and expanding the knowledge of healthcare and outcomes. We are thrilled to welcome Andre today to share his views and facilitate this important discussion on how we transform seniors' care in Canada. Andre, thank you for taking the time to be with us here today. I'm passing it over to you now.
Well, thank you for that kind introduction and for the invitation here today. As you heard John mention, I have a long-standing professional interest in elder care, but also a personal interest. My father and his 7 brothers were all veterans, and some of them benefited from the care of the once mighty network of veterans hospitals across Canada, Sainte-Anne-de-Bellevue, Perley, Sunnybrook. My new book, Neglected No More, actually features a chapter on Sunnybrook, and it talks about it as a model of excellence in care. And we can learn a lot about how we've treated our veterans, about treating elders more broadly in society. There's no question that as society changes, we must adapt care to the needs of the aging population. Investing in research is essential. Organizations like Perley Rideau Center of Excellence are crucial to our quest to deliver quality care to our loved ones. And that's why I'm happy to be here today to be part of this announcement. But you're not here to hear me talk, you're here to hear our expert panelists. So I want to, without further ado, introduce them, and we'll have a wide-ranging conversation that follows. And I have to say, as I introduce them, that I won't do their biographies justice. They're going to be very brief, but we want to hear them talk rather than hear about their great accomplishments. So I'll start with Dr. Annie Robitaille. As you've already heard, she's the new Commissionaire's Ottawa Research Chair in Frailty-Informed Care at the Perley Rideau. And she's spearheaded their life-saving research since she was first named the chair in January 2020. Welcome, Dr. Robitaille. Nick Nanos is the chief data scientist for Nano Research, where he leads one of Canada's most distinguished research companies. He's a well-known pollster, among other things. Dr. Jane Rylett joins us today. She's the scientific director of the CIHR's Institute for Aging and recognized internationally for her contributions to the studies of cholinergic neurobiology and Alzheimer's disease. And finally, we have with us also Lisa Levin. She's the CEO of Advantage Ontario, which is a community-based not-for-profit organization dedicated to supporting the best possible aging experience for Canadian seniors, which is, of course, what all of us want, is a best possible experience. So we're going to talk about that and many other things today. But I wanted to ask first, call upon Dr. Robitaille. I know she's excited about this $2 million gift, but I want to ask to begin with a fairly technical question. I want to ask, what is frailty-informed care? What does that mean, and why does it matter to pay attention to frailty?
Absolutely. Well, we know that living with frailty puts individuals at an increased risk for a number of negative outcomes. We've heard it: hospitalization, mortality, loss of autonomy, and poor quality of life. But we also know that not all individuals live with the same level of frailty and complexities. And that most importantly, there are many things that we can do to prevent or delay the onset of frailty, and even to reduce the impact that frailty can have on one's quality of life. So knowledge is really key here, and frailty-informed care is really about using a comprehensive resident and family approach to care so that we can assess people's level of frailty, their strengths, their weaknesses, but also their preferences, in order to really make sure that their care is tailored to their needs, so that, again, all about maximizing their quality of life and their families. Why does this matter? Well, even though not all older adults have to live with frailty, frailty does increase with age. And obviously, with the aging population, frailty is also likely to show an increase. Also, all of us at some point in our life will be affected by frailty. And even if not directly, maybe a loved one that is living with frailty. More recently, also, there's COVID-19, and so that's further highlighted the importance of more research on frailty-informed care. And so I think it's really time for us to invest in research that really prioritizes the implementation and the dissemination of research, specifically on the care of older adults living with frailty, veterans living with frailty, and their loved ones.
Now, as a non-expert, when I hear the word frailty, I think of somebody with a cane walking along. Is it more than just the physical aspect of limping along? Is frailty broader than that?
Yeah, absolutely. I mean, frailty is it's a medical condition that really reduces your functioning. It's a number of things like reduced walking speed, for example, a number of comorbid conditions. Most importantly, I think we need to remember that frailty is something that is impacted by a number of factors, such as social isolation. It also, causes depression and a number of negative outcomes that are important to take into account and to assess and to better understand and research.
Great. And in the panel, we'll talk more how to prevent this, and you'll give us some tips a little later. I want to jump over to Nick Nanos. We know that COVID-19 has had a really disproportionate impact on seniors, on elders, especially in care. We've had 26,000 deaths in Canada. About 17,000 of those have been in these care facilities. So there's been a real impact. With your polling, with your research, are you seeing a renewed interest and focus from the public to want to deal with this issue of treating seniors better?
Absolutely. And Andre, first of all, I'd like to thank the organizers for inviting me to join for a number of reasons, including the fact that I have a son that's a naval warfare officer. I'm an honorary captain. And from a research perspective, this is one of the most important areas that we've been doing research in, unpacking not just what seniors think, but what Canadians think about seniors care. And the fact of the matter is that before the pandemic, this was on the agenda for many Canadians. And a lot of this had to do with what I would call the sandwich generation, where there would be middle-aged Canadians who are not only making health decisions for themselves and for their children, but were making health decisions for their parents. And when you add the demographics, and Andre, you know this better than anyone else, when you compound the demographic trends that we're seeing, where we have more of an aging population that is comprised of kind of our society, it just puts it on the radar. So, you talked about a renewed focus. I think it's just going to be a trajectory of continued intense focus on seniors care, because what everybody understands now is that even if they're not making health decisions for a loved one and a senior, they will be making decisions either for themselves or their loved ones at one point or another. The interesting thing is that the pandemic has heightened focus on the full diversity of seniors care and put it and made it very immediate as we all are concerned and think about the health care that our loved ones who are seniors will need. And one quite interesting thing from a research perspective is that, and I think this is very important for public health officials and experts, when we talk about all the different directives that are put out there in the public domain from our public health experts, to get vaccinated and to socially distance and to wear a mask and all that kind of stuff. The interesting thing is that when we do those surveys, those national surveys, seniors are actually at the forefront and are the greatest supporters of these public health initiatives. They're most likely to want to make sure that as many Canadians as possible get vaccinated, that people continue to social distance, that we continue to be vigilant in fighting the pandemic. And I think a lot of that has to do with the fact that for seniors, regardless of kind of what I'll say their medical state and their state of their health, they look forward to continuing to participate in society and to be active. And as a result, what we're seeing, at least in our research, is a lot of interest in issues related to frailty, how that's a medical condition and how that can be treated and how we can help Canadians get through that so that they can lead great productive lives. And also to make sure that the right care at the right time for the right person can be delivered, and that we're using kind of world-class best practices. So this Perley Rideau initiative is absolutely in the right place at the right time. And I think there are going to be a lot of Canadians that are going to be very excited at the work that's going to come out of this new Center of Excellence that's being supported by the commissionaires.
And can you give us a sense, Nick, of what matters most to Canadians? What do they want fixed in this area, and seniors in particular? What do they want addressed as a priority?
Well, this might sound really, this might sound silly, it might sound odd, but they want control and hope. It's basically as simple as that. Canadians, whether they're seniors or people that think that they're going to be kind of dealing with those issues, they want to be able to exercise the greatest level of control over their lives so that they can live independent lives. And, we're just talking about basic things. Dr. Robitaille talked about walking and stuff like that. And, it's just simple things like having a certain level of personal independence. And the other thing that they want is hope. And I think this is where the educational component of the work that the Perley Reader Robertson does is actually critical, because we need to, from my perspective and the research that we've done, we need to reframe frailty and to make sure that people understand, hey, this is a medical condition. There are things that can be done. If you can intervene soon enough and you don't let things kind of accumulate, there can be hope. And I'm hoping, no pun intended, but I'm hoping at least that the Perley Rideau, this new Center of Excellence, can advance not just kind of clinical and solutions to kind of practically help this, but also to educate Canadians on how they can live in the future, how they can manage frailty, how they can treat frailty, and how they can remain as independent as possible. So there you go. Hope and control. That's what people want.
Well, and those don't sound odd to me at all. They sound very aspirational and something we all could benefit from. So, Dr. Riley, I want to bring you in. We talk a lot about elder care these days because of COVID. People want more home care, more long-term care, more care. But what about the research aspect? Why is that important? And how do you convince people that doing research actually is going to make their care better down the road?
Well, thanks very much, Andre. I'd like to start by thanking the organizers for inviting me to participate today. I'm absolutely thrilled, and congratulate the Perley Rideau Center of Excellence on the wonderful gift that they received from the Commissionaires Ottawa, and thank the Commissionaires for this gift, because this certainly will make a big difference to the understanding for care of our most vulnerable Canadians. So Andre, what I'd like to do is start actually with some definitions, a little bit academic, but start with some definitions about types of research, and then illustrate with a relevant example. And actually that'll pull the center into this example. So I think Dr. Robitaille probably knows where I'm going with this. So applied research is really a practical application of scientific findings, and it's a critical link between basic and fundamental research and implementation science, which leads to knowledge translation. So if we look at basic or fundamental research, this is focused on the creation of knowledge and advancing scientific information. And then applied research can come along from that, access and use those accumulated theories, that accumulated knowledge that have been identified in basic research, and then address and answer questions related to that, and these are aimed at solving practical problems. So in this case, frailty would be the problem, the issue that is being addressed by the applied research. So the goal of applied science or applied research in terms of health would be to improve the human condition, leading to new practices, leading to new treatments, new care paradigms for a particular situation, in this case, frailty. So the results from this applied research then can be implemented. And this now is evaluated by a new branch, a relatively new branch of science called implementation science, or the implementation science approach. And this is a critical step to take applied research findings and then move that into translation and mobilization into the healthcare setting. So implementation science is basically to promote the uptake of research findings, to make them evidence informed, so gaining data around it, to get evidence to inform the practices, and then to use that to improve the quality and effectiveness of health services. This can be an iterative process, and it's measurable. And so then we go to translation from there. So the translation process then grows out of this data, this evidence-informed transformation of care practices to health services and improving the quality of care. So let's look at an example. So the CHR Institute of Aging that I'm the scientific director for partnered with the Institute of Health Services and Policy Research very early on in the pandemic. We knew immediately, way back in March, April of last year, that the older adults are the most vulnerable in our society, and those within long-term care or retirement homes were particularly vulnerable, partly because of their health status, their frailty, but partly because there was not a strong infrastructure built up around them to be able to mitigate against the impending infections that were coming in. So we, our two CHR institutes partnered with Healthcare Excellence Canada, and we developed a funding opportunity for researchers across the country to form what are called implementation science research teams, and then to be able to work in partnership with long-term care and retirement homes to be able to investigate the best practices. And it's interesting because Healthcare Excellence Canada had already come up with what they term promising practices, 6 promising practices that they wanted to roll out in long-term care homes to then be able to change practice to be able to mitigate against future risk in future phases of the pandemic. But there was no evidence to inform which of those promising practices might work well, which would work in what setting, which might not work in a different setting. And so we put out a call from CHR for implementation science teams, and we funded 22 teams across the country in partnership with some of our provinces, in partnership with other CHR institutes, to then do the evidence analysis for these promising practices. And Annie Robitaille is the lead on one of those teams. So Perley Rideau figures very prominently in this endeavor, this initiative. And so Annie, along with her collaborators, are investigating 2 of the promising practices. One is the presence of family, and we all know the situation where family couldn't come into most long-term care facilities for many months, and this had a hugely negative impact on both residents as well as family. And so Annie and her colleagues are assessing how better to do this type of quarantine and isolation, and the need for the presence of family. And her and her collaborators are also looking at what's termed people in the workforce. For those care workers within long-term care settings, what their needs are, what support they needed to be able to work more effectively and mitigate against future risk, whether that's from the pandemic or even in influenza season, for example. So this is a great example of how applied science the promising practices have then been moved into implementation science, where the promising practices are being evaluated. And then at the end of this 1 year of investigation, Annie and her team of implementation scientists, along with the 21 other teams, will move forward, and we will have knowledge mobilization and translation activities a few months down the road, and then be able to use that evidence-informed data for new practices to roll into long-term care homes and retirement homes as we move forward. So that's sort of the process around research, but what the outcome of the research can be, along with an example that actually involves Perley Rideau in how we have been able to work rapidly to address some of the very initial problems that we saw in the pandemic, and hopefully yield information that will transform practices as we come out of the pandemic.
Great, and we'll come back to some of those examples in a moment, some of the more practical ones. Lisa Levin, I want to bring you in. You work with providers, the on-the-ground providers. Tell me how research matters to them, and how does research influence the delivery of care to elders?
Thanks, Andre. So research is really critical, especially at this point in time, because we are at a crossroads in long-term care, and the public and government has basically awakened to what we've known for years, that we need more resources, more staffing, and more funding in long-term care, because the acuity and frailty of residents has been increasing and will continue to do so. So this has resulted in residents coming into homes that staff haven't been trained to handle and homes haven't been equipped to deal with. And as you know, there's been a report from the COVID-19 Commission, and there's sobering statistics in there that 86% of residents in long-term care need extensive help with daily living. So long-term care homes want to be able to provide the best care for residents to keep them safe and live their lives to the fullest. And in order to do that, we need proper evidence-based care options. And that's why this center and its research are so critical. So I'll give you a few examples. One of the projects Perley Rideau is doing is looking at the benefits of social visits between university students and residents with dementia. Another is the development of CME, which is a frailty assessment and management framework that adopts a holistic, individualized approach to care. And Perley is using simulation-based training methods to strengthen best practices on falls prevention. So these are things that impact people every day. And then as Dr. Rylett was talking about, the psychosocial impacts of COVID-19 isolation and program restrictions. So the other way that this can help, other than improving people's quality of life, is it helps with advocacy, because government does not currently have a clear enough understanding of frailty to address its issues through public policy. So in all of these ways, the evidence that comes from this very practical research will help to change the lives of people in long-term care.
And can you talk about how difficult is it to bring in innovations that you learn from research when you're kind of just scrambling to keep your head above water as it is?
It depends on the innovation. Often homes do it on their own without government backing. And that's why donations such as this are so important, to enable homes to be able to put into practice things that they know will help people in long-term care. But eventually, with enough evidence and on-the-ground experience, we can convince government to help fund things.
Okay. Now, Dr. Robitaille, I want to come back because you gave us a teaser earlier. You said you were going to tell us how to prevent frailty, and I'm sure that's of great interest to our audience. So tell us practically, what can people do to stay mobile, less frail as they age?
Oh, there's a number of things that people can do. I mean, engage in physical activity, go for walks. Nutrition is a big one. Your diet will also have an impact, on your level of frailty and on delaying the onset of frailty. And then there's also all these social aspects. I think these, obviously, it's something that's dear to me. It's a big part of my research, but the importance of engaging in social relationships, in engaging in meaningful activities, all these are things that are important. So, keep doing endurance training, if you want, go out for walks outside, all these things can definitely have an impact on reducing the impact that frailty can have on one's life. And so there's many things that one can do.
And let me ask you a question, the kind of question I get from my readers at the newspaper who say, come back to your research project about isolation and locking out of caregivers. My readers say, of course that's bad for people. Why do you need to research it? Let's just stop doing it. It was stupid.
Well, you know what? That's something I say often, is that there's quite a few programs out there that, we tend to see have a positive or we believe have a positive impact on the quality of life of older adults living with frailty, their families and so on, but that have not actually been researched. And so there is still an immense need for more research on, evidence-based research on various different programs that can help to increase social participation, that can help to reduce social isolation, so that we can better understand what it is about these programs. Do they have a long-term or a short-term impact? All these things are important. And again, making sure that that information is disseminated widely across all stakeholders, so that they can then be further implemented successfully across, Canada and so on.
And Nick, maybe putting you on the spot, but I'm wondering if you have, you've done research on this topic of social isolation and what the public thought about the lockdowns of homes, et cetera. Can you give us a sense of the public view of their worries about being isolated, et cetera?
It's interesting. Among the most striking pieces of research that we've done during the pandemic was actually unpacking the impact of the pandemic on people individually. And we shouldn't be surprised that the pandemic has had a materially negative impact on everyone's mental health, period. And it's worse this year than it was last year. So the trend is moving in, and hopefully with the vaccinations that will change. But one of the things that I found quite interesting is that when we ask Canadians about their long-term impact of the pandemic, there are some positives, and those positives have to do with things like not taking loved ones for granted, right? Rethinking our priorities, what's important and what's not important, and things like that. And you know what? This whole discussion about care for seniors and frailty fits into that, because what it's done is it's put a spotlight on our loved ones and the support that they need in order to kind of be as healthy as they can be. So I think we're at a moment in time where, yes, there have been lots of negatives related to the pandemic, but in a way, it's kind of shaken a number of Canadians to wake up, right? That they have to think about their loved ones a little more. They have to think about what's important in life. And I think as a result, I think, this initiative from the Perley Rideau, and this whole center of excellence is, like I said before, I don't want to sound like a broken record, is in the right place at the right time, because people now know that this is important. And we're no longer, if I was to say this 2 years ago, many Canadians were kind of sleepwalking on this issue. Well, you know what, Andre? Now they've woken up. And I think we're at a moment in time where we should be taking advantage of Canadians being engaged on this and moving forward with evidence-based solutions in order to make people's lives better.
Great. And Lisa, I saw you nodding when we were talking about the lockdown of homes and the isolation. Can you talk about practically the impact of isolation on people in care before COVID and during, what we've learned?
Well, we know that over the years, research has shown that isolation could be worse on your health than smoking a pack of cigarettes a day. And you would hear that and think, oh, well, is that really true? But we've seen through the pandemic with everybody how isolation has had such a poor impact, and how, in particular, seniors in long-term care or seniors living alone in the community have been really, really impacted. And I would say that there are some seniors that probably have died of loneliness during the pandemic in long-term care and outside of long-term care. Because when you have an outbreak in a home, seniors are locked in their rooms, like not locked, but they are in their rooms. They're eating in their rooms. There's no socialization going on. And that is a critical element of health for somebody. And so it's a horrible experiment that we've just gone through, if you want to call it that. But we have now seen the impact that it has had. And so it really brings to light how critical it is that seniors have contact with others, that they are engaged mentally and physically. And, you know, we just can't let this happen again, that, you know, to protect their health from COVID, we created another health risk. So it's been a really difficult situation.
And you think, had we had research, do you think we could have prevented this? We could have sort of waved a paper at the government and said, listen, here's what's going to happen.
I think once we had enough PPE in homes for caregivers, we should have had essential caregivers in the homes earlier. At first, nobody knew what was going on. Nobody knew how this would spread, and we had to close the doors down. But I think we could have brought the essential caregivers in earlier. And that's another thing that has come out of the pandemic, is recognizing the importance of essential caregivers in long-term care. There's a myth out there that once someone's family member or loved one goes into long-term care, that the caregiver, the family caregiver, doesn't have as important of a role anymore, but they do in many cases. And it has really come to light during the pandemic.
Okay. And I'll remind the audience, if you have questions, type them into the chat. I'll be happy to incorporate them into our discussion. Dr. Rideau, I want to come back. You talked before about implementation science and the importance of that. People often wonder, we have these great ideas. Why does it take so long? And why does there seem to be resistance to implementing good ideas? Can you explain that scientifically?
What a great question. And I'm not sure I have a great answer, but it takes a long time to conduct studies and to get them to completion, to validate the information. And then there's also an issue of verification. So we often hear that, this group is going to be doing a study very similar to what another group did. And there's a concern around duplication, but the reality is it's not really duplication. Part of it is verification. So another group may ask the question differently. They may use different methodologies and approaches to be able to address the question or hypothesis. And they may arrive at the same answer or a variation, somewhat different answer, which all adds together on the information. So I think it's really important that data be validated, that there's time to digest it and to be able to look at mechanisms to be able to translate that information and what works in what situation and what may not work in another situation. So the whole issue around scaling and spreading research findings and mobilizing them into, in this case, long-term care and retirement homes or into the healthcare system really becomes critical to be able to get it right. And so I think that's what takes so very long to be able to accomplish that and to be able to ensure that the data is representative of a more generalized situation.
But is there enough risk taking? Is there enough of just saying, hey, look, I saw this in another country, why don't we try it?
Yeah, that's it. You know, risk is difficult to manage, partly because researchers need to be able to acquire the resources, the financial resources they need to do their work, to be able to have a team built around them, to be able to do the work properly. And so there's a long application process to agencies like CIHR or other funding agencies to acquire the resource to do the work. And if there's too much risk perceived in the work, then they may not actually get get the resources they need to do the work. And so that's why gifts like this to this Center of Excellence are actually important, because it will allow Annie and her colleagues to be able to take those risks, to be able to ask those questions that they really want to be able to get answers to in time. And so you're right, Andre. It's important that researchers look around the world, be able to see what happens in different cultures and different settings, by addressing the question in certain ways and what resources they need to be able to accomplish the goal. And then to be able to look at the Canadian situation. So there are some things that clearly are going to be unique about the Canadian situation that we can't just apply directly from other countries around the world, but we can learn from their experiences, and we can adapt and modify and try to make the Canadian solution. So there are many ways to go about this.
And Dr. Robitaille, we have a great question from the audience asking, well, who does this right? Who can we learn from? What country does frailty-informed care well?
Well, there's not a one country specifically. I think it really depends. There's so many different models of care that are available. Even in Quebec, we've had a webinar. We now have a webinar series, part of the Center of Excellence, and we've had Philippe Voyer come and talk to us about the importance of transforming long-term care homes and being more open to making sure that long-term care homes are actually more like homes and less like institutions, and following some of the models that have been used in various countries. And so, yes, for sure, there's quite a few models that are available across the world, and we are in fact looking into those and seeing what it is that we want to implement within the Perley Rideau, but also other long-term care homes across Ontario and Canada, and see how those can in fact improve the quality of care, improve the quality of life of people living with dementia and their family members and caregivers. I think it's also another point that's important to make, that is really important that we invest in another thing that's dear to me is in building capacity by prioritizing the training of healthcare professionals, students, trainees, and early career researchers that really want to pursue a career working with older adults and veterans, across the continuum of care, including long-term care. I bring that up because I think that I was extremely lucky in that I was provided with opportunities during university to realize the impact that I could have on older adults. Not all students have access to that. It seems like they're all interested working with kids. And so I was, in addition to that, I was also provided with, a number of networking opportunities, training opportunities, research opportunities that really had an impact on my trajectory and my career. And so the Center of Excellence is really wanting to also invest in that next generation and to really provide the same opportunities that I was provided to. And so it's not, the Center of Excellence is really about partnerships, collaborations that would really help to build, I think, a network of stakeholders all invested in working in improving the quality of life of older adults living with frailty, veterans, and really promoting innovative, ongoing improvements by using some of the models that are now being implemented in other countries.
Nick Nanos, we have another interesting question. You mentioned that people have woken up to the issues of elder care because of COVID. Someone's asking, well, have the politicians woken up? The public cares about this, but are the politicians going to act?
Not enough. How about this? They're half awake because they need to wake up. We need to jolt them a little more, I think, and this happens a lot of time on big public policy issues. People are always ahead of the politicians, and the politicians catch up after the fact. I would say that, I would say one of the challenges will be the fiscal environment that governments face, period, coming out of this pandemic. The government has taken on, and all governments around the world have taken on unprecedented debt to fight the pandemic, both from a public health perspective, but also economically. And then the big question is how much fiscal room will there be to make sure that we fund important initiatives like the initiatives that we're talking about today? And so there might be an interest or willingness, but what I worry about would be politicians saying, what you're really doing on frailty and seniors care and all that stuff is really important. We love the stuff that you're doing, but we can't really pay right now. We can't pony up cash to invest in this. Please come back. But the fact of the matter is that for something like this, there can't be a delay. And I think there are public health and also public policy reasons why that investing now is actually just good public policy and good public health. And that with all the competing pressures that governments will be on. So I think politicians will want to do something, but I think the whole sector has to be very vigilant and proactive in order to, it might be odd to say, we have to have our elbows up as we go in to make sure that things get properly funded today. So I think the intent is there from politicians, but I would worry about them getting squeezed because of other financial priorities. And I think that's going to be a real pressure on not just the health sector, but on government finances writ large.
Now, Lisa, there's another audience question. I don't know if you're the best person to answer, but I'm going to throw it your way, put you on the spot. Someone's wondering, there used to be this great network of veterans homes that was federally run, and they kind of turned them over to the provinces. And the audience member is saying, they have a sense that the care has suffered as a result. Is that your feeling that turning this over to this great network that once existed has resulted in lesser care for veterans?
I actually probably am not the best person to answer that, Andre, because I don't know a lot about the impacts that have had. If it's resulted in less funding, because maybe the federal government would have reduced funding by doing that, then that would make sense. So I don't know, perhaps another panelist can help with that one, but I don't have a lot of background on the veterans programs. I do know that that by far the programs for seniors who are vets have exceeded, in value and in richness of almost any other program across the country in terms of the supports that have been provided for seniors who are veterans. And certainly that's something that really should be provided to all seniors in the province, in the nation.
Well, so let me ask you that way. Why don't we provide the same care to everyone that we provide to veterans? It's great that we give them good care, but why isn't everyone getting that level of care?
Yeah, that's an excellent question. And I think that really this is our opportunity to keep the momentum going so that we make sure that the government does remember what happened in COVID and does increase funding for long-term care. And I think that it's not just up to our association does a lot of advocacy work on behalf of our 400 members. It is up to each and every Canadian to ask their politicians, because they're going to come knocking soon for federal elections and provincial elections, and say, hey, what are you doing for seniors? Until it is top of mind for each and every Canadian and the pressures put on, we can't just blame it on the government that they haven't provided enough resources for long-term care. The government responds to the electorate. So it is all of our collective responsibilities to demand that and to ask for that, so that all seniors can be treated with dignity in their last years of life.
Okay. And Dr. Rideau, I'll send another question your way. Someone's wondering, is there research being done on quality of life in institutional care, and particularly for people with dementia? Are we paying enough attention to that?
So that's an excellent question. Of course, there is a lot of research being done on this, both within Canada and internationally. So the whole aspect around cognitive impairment and dementia has been a topic of a lot of consideration over time, but I think it has been accentuated also by COVID. So for example, the issue around isolation and loneliness probably will have an impact on the course of dementia and the number of individuals, the prevalence of dementia as we move forward. And so that's an area of active investigation right now. So Canadian platforms like the Canadian Longitudinal Study on Aging are doing studies that will monitor mental health and dementia, cognitive impairment going forward in the coming years, and then try to correlate that with the impact of COVID. The Canadian Consortium on Neurodegeneration and Aging, which is another very large research program of over 300 researchers across the country related to neurodegeneration and aging and Alzheimer's disease and dementia in particular, are also investigating this. So we are soon launching a new platform, new program on brain health in aging and transition to mild cognitive impairment, and dementia. And some of this will be centered around risk reduction and risk mitigation to move from healthy brain aging towards cognitive impairment and Alzheimer's disease. And it's considered that if you take a life course approach, you can reduce cognitive impairment and dementia by as much as 40% by addressing early and midlife risks towards changes in health of older adults. And so this is a large topic of investigation in Canada. We have an outstanding group of researchers in the country that can address all aspects of this, from disease pathogenesis all the way through to care paradigms, quality of care, and equity around care, which is another huge topic when you think about stigma and ageism associated with dementia.
And I'll ask you another related one. Lots of interesting caregivers in the chat. Is there research being done on caregivers and how to help them out and help them because we know they do the vast majority of the work out there?
Absolutely, and this is another area that we put a lot of emphasis, whether it's formal caregivers who have this as an occupation, or whether it's informal caregivers who are family members who are caring for loved ones, whether it's parents or spouses or other relations that have dementia. These individuals are particularly vulnerable. They're vulnerable to burnout. They're vulnerable to increased health risks themselves. And they can also be vulnerable, unfortunately, because sometimes individuals with certain stages of dementia have behavioral problems that can cause them to act out or to be violent and to mistreat those that are caring for them. So the health and well-being of caregivers, both formal and informal, is a critical topic and one that we incorporate into our research programs.
Now, Lisa, I'll toss another tough question from the audience your way. Are we putting too much emphasis on institutional care, not doing enough comparative research, say home care versus institutional care, and how we can get that balance better?
Absolutely, Andre. The tendency for government is to take a siloed approach. So a lot of the pandemic was about long-term care, but then home care suffered and home care services declined dramatically. People want to live at home as long as they can as they age. And we need to have a continuum of care for seniors in this province. So there still will be many seniors that will have such complex needs that they require long-term care. But at the same time, we definitely can do a lot better with our home care programs and also have more supportive housing for seniors, because right now there's a missing middle in Ontario. We have home care, we have retirement housing, and we have long-term care, but not everybody can afford retirement housing in their community. And so they end up in long-term care prematurely. And so we need to make sure that we have this full continuum of care and options for seniors, as well as more day programs in the community, Meals on Wheels, community transportation, all of those things that keep people living at home. Even something as simple as having someone to mow your lawn and shovel your snow can be what puts people on the edge of having to go into long-term care or another setting. So we do have to look at the whole thing. In Ontario, we have a Minister of Seniors, but that ministry is focused a lot on retirement housing and some general accessibility issues and general seniors issues. But supportive housing is under the Ministry of Health. Long-term care is under the Ministry of Long-Term Care. Home care is under the Ministry of Health, and retirement housing is under the Ministry of Seniors. So how can we have a conversation about a continuum of care when we have such disjointed silos within government? We do need to look at this together because they all interrelate to figure out how we can offer the best menu of supports for seniors in Ontario.
Yeah, I like that comment about the missing middle. We don't do a lot to keep people in the community. We kind of default to the homes. But so, Dr. Robitaille, I have a question that says, you have to ask Annie about CME. So I'm going to take my hint from the audience and ask you. Tell me about CME.
Yeah, so CME is actually a program that was initiated, by the Perley Rideau, and that is having a huge impact. It's really all about the management of frailty, making sure that that a framework is adopted and takes a holistic, individualized approach to care. It's, again, as I mentioned earlier, like making sure that the strengths of the person are taken into account when we're thinking about the care of frail older adults, their preferences and all that. And so it is a program specific, to frailty that uses a frailty management framework, and that is, shared widely with, other long-term care homes that wish to implement it.
Okay. Now we only have a few minutes left, and we're here today celebrating this amazing $2 million gift. So I want to end by asking each of the panelists, what's the biggest opportunity for the Center for Excellence to use this money to transform care? So I'm going to ask each of you to give Dr. Robitaille some guidance on where she should be putting her priorities, and then I'm going to give her the last word. So Nick, do you want to start us off? What should the priority be from a public perspective on research and frailty?
Well, it has to start with research, but obviously, invite a pollster to a panel. He's going to talk about education and communicating with Canadians. So I would say it's a 1-2 punch of research and engage and education. And it would be great if Perley Rideau can lead a national dialogue on this and to engage Canadians and to have research and evidence-based kind of interactions on this so that we can all move forward. And I think it would be a great win for everyone if this whole idea of reducing the impact of frailty and figuring out strategies for that, if people clearly knew that it was a personal good, it was a public good, and also an economic good, so that we can devote our healthcare, our scarce healthcare resources at the right point in people's times, and dealing with frailty could be a big game changer in how healthcare resources can be deployed. And I think Perley Rideau can take a leading role in solutions and just having better healthcare outcomes for everyone.
Okay, Dr. Rylett, same question. Where can they have the most impact?
So great question. And some of the comments that I would make are similar to Nick's and around education and leadership. I think to be able to take advantage of the opportunity of having this great resource base around of a large number of individuals in long-term care home and in seniors apartments and veterans and older adults, to be able to look at what best practices are and to be able to look at that from a holistic approach. So what is the best care plan tailored to individuals? What is the best care plan tailored to actually the environment around those individuals? So the health and well-being of both the residents and the health and well-being of the staff that are around and those that interact, and also considering the health and well-being of those essential caregiver family members that come as well. So really taking a holistic approach. We know that Canada is slated to become a super aged country within the next decade or so. And so right now, approximately 1 in 5 individuals in Canada are over the age of 65. That is going to change to 1 in 4 within the next couple of decades. And we know that the oldest old, that group of individuals that are 85 years old and older, is the fastest growing segment of our population. These are the people that are most vulnerable to frailty and need the most attention. And so even looking at this in a stratified way, so the younger old individuals, those who've just become seniors, what are the needs of that group? But then what are the needs of those much older individuals, and stratifying and looking across that to see where special care may be needed to mitigate frailty. And I think Dr. Robitaille did a great job of describing frailty and what the impact of that can be and how you might reduce that. And so I think advancing that forward and working on that is a great way to go.
And Lisa, I'll ask you too, how can the Center of Excellence have an impact on transforming care?
I think that by understanding frailty better and how to reduce it and prevent it is very, very powerful. Just that in of itself, people don't realize that frailty is not a one-way street, that people can improve. And how many of you can just think anecdotally of a loved one of yours who's gone into a retirement home or a long-term care home and who's gained weight and who has thrived? You know, people often think, oh my God, long-term care, that's the last place I want to be. But often people who've been living alone in isolation without proper nutrition or stimulation really decline. And when they go into long-term care, some of them perk up. And so it's just by showing through, you know, evidence after evidence, piece of evidence that people's health can improve, that frailty can be turned around to some extent, will have an enormous impact, and will also, going back to Nick's comment, give people hope for the future of seniors. So that's what I think is a very powerful impact that the center can have.
Great. So Dr. Robitaille, the final word is going to come to you. You got some great advice. Tell us how you're going to have an impact. And before you do that, I'm going to just read one comment from the chat because I think it sums up what people are saying. Person saying, as a gerontological researcher and the daughter of 2 former residents of Perley, Rideau, I'm looking forward to the important work of the Center of Excellence. So tell us where you're going to take this, Dr. Robitaille.
Yeah, absolutely. The Center of Excellence is really looking to leverage partnerships, engage a broad range of stakeholders. We are not doing this alone. We are going to invest in the new generation of researchers. We are going to, make sure that we work closely with a number of experts in the area of aging across the continuum of care. We realize the importance of following individuals living with frailty across their journey, and some of those will start in the community and move into long-term care homes. I was really drawn to the Center of Excellence because it is surrounded by people, including staff, friends, family, volunteers, research experts that all value a research culture and that really want to invest in transforming the care and the quality of life of older adults living with frailty, of staff, of caregivers, family members. And so we are extremely excited about, the work that is ahead of us, the partnerships that are ahead of us, and obviously a big thank you, to Commissioners Ottawa for the great gift that will help us to move this forward even more quickly.
Great. And thank you. I want to wrap up by thanking our panelists, Dr. Jane Rylett, Lisa Levin, Nick Nanos, and of course, Dr. Annie Robitaille. I'll end with the words. I have the privilege of talking to a lot of elders in my work, And they always come back. I always ask them, how do you want to live out your life? And there's always three words that always come up. I want to live with autonomy, with dignity, and with respect. And I think what this research is going to do is advance those goals in society. So I'll finish by thanking the commissionaires for their amazing gift and turn it back over to Delphine to wrap up the event. Thank you.
Yes, thank you, Andre, and thank you to all our guests today. And if I can ask everyone who has participated today to turn on your video, because I think, I want to thank you so much for your commitment of improving the lives of seniors in Canada, and for your support to the Perley Rideau. That is invaluable. But really, I think today what I heard is a message of hope and a better future for us all, because if all goes well, we're all going to get old. So that is fabulous. I want to say thank you very much again to Commissioner Ottawa. And really, we are the phase, we are in our Answering the Call fundraising campaign. At this stage, we are seeking for transformational gift from individual and organization who shares our goals and our value. And I think, Annie, you did a great job to really show what's important to Perley Rideau and the Center of Excellence. So thank you for that. And I hope you will all consider a donation today. If you want to learn more about the fundraising campaign or the Center of Excellence, please visit our website. It's www.answeringthecall.care, and it's answeringthecall.care. And really, I want to thank everyone for all the participants as well for joining us today, and wish everyone a wonderful day. Thank you.